Morning all. Right to go? Okay, thanks everyone. Thanks for coming along this morning. I've got a bit to do, so bear with me, and then I'll hand over to the Minister for Health, and Professor Sutton is here as well, and we'll answer all your questions. So there are 34 active cases of coronavirus in Victoria. A remarkable 40,411 people got tested yesterday, the most ever processed. So my thanks to everyone. I know there was a level of inconvenience with those magnificent numbers, but I do thank everyone for getting tested. And we had 12,677 people getting vaccinated, another extraordinary number, and my thanks to everyone who are hearing the call. The best thing we can do is to get vaccinated when we're eligible. We said this time yesterday that the next 24 hours were going to be particularly critical in terms of what our next steps will be to ensure that we keep our state safe. In the last day, we've seen 12 linked new cases, bringing the total number of cases linked to the hotel quarantine breach in South Australia to 26. Sadly, we have one of those people in an ICU on a ventilator in not a very good way. In the last day, we've seen more evidence that we're dealing with a highly infectious strain of the virus, a variant of concern which is running faster than we have ever recorded. As of first thing this morning, we've identified in excess of 12... From first thing this morning, we've identified in excess of 10,000 primary and secondary contacts who will need to either quarantine or test and isolate, and that number will continue to grow and change. Our public health experts' primary concern is just how fast this variant is moving. And we've seen overseas how difficult that movement can be to control. Here in Victoria, we're seeing not only how quick it is, but how contagious it is as well. Our contact tracers are identifying and locking down the first ring, second ring and third ring within 24 hours. They've never done that before. That is the fastest our contact tracers have ever moved, within a 24-hour period, identifying and locking down first, second and third rings of cases. But despite working as fast as this, and my thanks to all of our contact tracers, this variant is moving faster still. The time between catching the virus and passing it on is tighter than ever. So for some of those cases that I've mentioned, for some of them, the serial interval, that is how long it takes between the onset of symptoms in the first and secondary case, is averaging just over a day. Now, to put that in some perspective, the usual transmission is about 5 to 6 days. In some of these cases, within a day, it's being transmitted. And in just 24 hours, the number of cases has doubled. So unless something drastic happens, this will become increasingly uncontrollable. We also know our nation's vaccine rollout has been slower than we hoped. That is a fact. The vaccine rollout is not where we hoped it would be. It's not where it should be. And if more people were vaccinated, we might be facing a very different set of circumstances than we are today, but sadly, we are not. If we make the wrong choice now, if we wait too long, this thing will get away from us, and that's what we've been talking about for the last few days. And when we were here before you all yesterday, that 24-hour period was just so critical. And with 10,000 primary and secondary contacts, cases, with more than 150 exposure sites right around the state of Victoria, we've got to act now, and that is the clear expert advice from our public health team. So I'll take you through the changes that will be implemented. From 11:59 p.m. tonight, Victoria will enter a 7-day circuit breaker lockdown, and these restrictions will be in place until 11:59 on Thursday, the 3rd of June. If we can ease those restrictions earlier, we will, but this is a 7-day circuit breaker lockdown. So from 11:59 tonight, there are 5 reasons to leave home, not 4. Shopping for necessary goods and services, authorised work or permitted education, exercise, a 2-hour limit with one other person, caregiving, compassionate and medical reasons. So they're the existing four that we know and understand from previous circuit breaker lockdowns. There is a fifth reason why you can leave your home, and that is to get vaccinated. I can't stress this enough. The only pathway through this pandemic is for people to get vaccinated as soon as they are eligible, and for our state and our nation to have an alternative to quarantine in terms of high risk. For shopping and exercise, you need to stay within 5 kilometres of your house, unless your nearest shops are further away than that. Masks must be worn everywhere, indoors and outdoors, anywhere other than your home, unless an exemption applies. There are to be no visitors to your home other than an intimate partner. But single bubbles will be permitted. If you live alone, you can make a bubble with another person. And there are to be no public gatherings. In terms of what remains open, so restaurants, pubs and cafes can provide takeaway only. Essential retail, so supermarkets, food stores, petrol stations, banks, bottle shops and pharmacies. Other retail stores can provide click and collect. Childcare and kinders will be open as per the last circuit breaker lockdown earlier this year. Approved professional sporting events will proceed, but proceed without crowds. Authorised workers and workplaces. In terms of what will be closed or changed, schools will move to remote learning except for vulnerable children and children of authorised workers. Higher education will move to remote learning only. Community sport and recreation. Accommodation, but there will be some exemptions that apply. Hotels, clubs, tabs and the casino will be closed. Indoor and outdoor entertainment venues, swimming pools, spas, saunas, indoor and outdoor springs. Community venues like libraries, toy libraries, but click and collect is permitted. Hairdressing, beauty care and personal services. Drive-in cinemas, amusement parks and arcades. Creative studios, art galleries and museums. Tourism, tours and transport. And auctions can only happen online. In terms of our health settings, aged care facilities, no visitors except for very limited reasons. And in our hospitals, visitors only for end of life, to support a partner during birth or a parent accompanying a child. In terms of ceremonies, funerals, a maximum of 10 people plus those running the service. Weddings cannot proceed unless end of life or deportation reasons apply. And religious activities will not proceed other than through broadcast with a maximum of 5 people. So before I hand over to Martin to take us through some further detail in terms of vaccines and testing, the other thing that I indicated throughout this week is that we were looking at how we can expand the eligibility for vaccinations. And we've been doing that work, and we've got advice from Public Health and from the Department of Health more broadly. And I can announce that from tomorrow morning, vaccinations at state sites will be expanded to include those in the 40 to 49-year-old age group for the Pfizer vaccine. So that means now, in our state sites, if you are over 40, you are eligible for a vaccine. So we need you to call the hotline. We need you to make a booking. In terms of GPs, that will be a decision of the Commonwealth, but in terms of the state sites that we run, we'll be expanding it to 40 to 49. So I really encourage everyone, if you are eligible, get vaccinated. The reason why we are dealing with this outbreak today is because of a hotel breach in South Australia. That is not a criticism, it is just a fact. We've had breaches in hotel quarantine right around our country. The only way through this pandemic is everyone getting vaccinated as quickly as you are eligible, and for the Commonwealth to agree to an alternative quarantine arrangement, particularly for high-risk individuals. And in this case, we're talking about a variant of concern. If we had an alternative to hotel for this particular variant of concern, we would not be here today. If we had the Commonwealth's vaccine program effectively rolled out, we may well not be here today talking about these circuit breaker restrictions that we must impose to keep our community safe. I'll now hand over to the Minister for Health to take us through some further detail, and then we're happy to answer questions.
Thank you, Acting Premier. So I just want to make a few comments in regards to vaccines and testing. As we know from the implications of this South Australian case, that this virus isn't going away anytime soon in this country, and that vaccines are really such a key part of getting us back to something that approaches normal. Without full vaccinations for everyone that's eligible, this vaccine just keeps mutating, and even once we're all fully vaccinated, there's every expectation that we're going to have to keep booster shots well into the future until we beat this thing off. To that end, as the Acting Premier has indicated, subject to making sure that supply is maintained from the federal government, which we've got very good certainty for the next foreseeable period, that gives our public health team more than confident that we can expand, as the Acting Premier has indicated, our vaccination program through our state-run centres to people in the age group from 40 to 49. Under the Australian Technical Advisory Group on Immunisations recommendations given to the Commonwealth, that means that if you're under 50, so between 40 and 49, you will be eligible for the Pfizer vaccine from those state-run centres that have that capacity to deliver Pfizer. So my message to all Victorians is, if you are eligible to get vaccinated, make yourself a plan to do that today and get it done. You'll be able to book, if you're in that category, by calling the coronavirus hotline, or if you wish to and you're over 50, you can continue to walk up to any of the centres and get the AstraZeneca vaccine like I and many of my friends and family have. But the bookings for the Pfizer vaccine, they are essential. And people between 40 and 49 who will be provided that vaccine need to lock in that booking time, given the particular nature of that vaccine. Because vaccine is really our only ticket out of this, this is, as the Acting Premier's indicated, one of the pillars that we can all do to help get us out of this process. And as the Acting Premier has indicated, it is one of the 5 permitted reasons to leave home. In regards to testing, just to add a bit of detail to what the Acting Premier said, yesterday, with over 40,000 tests all turned around or being turned around within the space of the next day, and having done so on top of a number of days of increasing capacity over both Victoria, all of Victoria's sites, but particularly in the north and the west of Melbourne. We saw 99.5% of those tests so far this week all being returned in that next day period, in line with the national standards. And again, we know that there has been high levels of demand and in some centres quite lengthy periods of waiting, and I want to thank people for that patience. We are continuing to expand those services and we will continue to do so. In the last little while, there are now operating 196 testing centres around the state, with 40 of these having new or extended operating hours. In the last 72 hours, we've established 15 new sites, and we will establish a further 6 today, those being in Brighton, Cheltenham, Werribee, Ascot Vale, East Reservoir and Coburg, and the details of those sites will be up on the website coronavirus.vic.gov.au shortly. So I might leave my comments there and hand back to the Acting Premier.
Thanks, Martin. Happy to answer any questions.
Acting Premier, 7-day lockdown. Have you lost faith in the contact tracers?
No, not at all. And they're doing extraordinary work. And I just go back to what I said in my opening remarks. Our contact tracers, within a 24-hour period, are identifying and locking down first, second and third rings of cases. They have never, ever worked as hard, as fast and as effectively as they are right now. But despite that, this variant is moving at a faster pace. So our contact tracers are doing a brilliant job, but we need to get on top of this, and that's why we've got advice from Public Health. Given the circumstances, more than 10,000 primary and secondary contacts, more than 150 exposure sites right across the state of Victoria, Bendigo, Kahuna, on our border, right across metropolitan Melbourne. We need to have this circuit breaker lockdown. We know that it works. We know that it makes a difference. We've done this before. Victorians know what to do. But the contact tracers are working as quickly than they ever have before.
Deputy Premier, regarding lockdowns, part of the way the argument was made last year to have a lengthy lockdown was so we could avoid having to do it down the road. Is the truth that Victorians will have to live in a sense of uncertainty with lockdowns remaining a live option for the future?
Well, you go to last year, it was about defeating the second wave and ensuring we don't have a third wave. But there's only one path to defeating this pandemic, and that is the successful rollout of the Commonwealth's vaccine program and an alternative to hotel quarantine, particularly for those who are very, very high risk. Until we get to that point, until we have successfully rolled out the Commonwealth's vaccine program, and we're stepping up where we can. The announcement that we're making today to extend the eligibility for people who can get a vaccine from the priority cohorts to now anyone over 40 is what we can do to make sure we get there. But this is the Commonwealth's vaccine program. They're responsible for supply. Right now, we've got the supply we need, and that's why we're making the call to everyone. No one wants to be where we are today. But this is highly infectious and it is running at a super quick pace.
How are businesses going to survive now that we don't have JobKeeper?
Sorry?
How are businesses going to survive now that we don't have JobKeeper?
Well, we know that this is going to be particularly difficult for businesses, for events. We talked about the Rising event. There's a race at Winton. We know for many businesses and for events that have to be called off for this period of the circuit breaker lockdown, we know that this is very, very difficult. We'll provide additional support, and I'll have more to say about that in coming days.
Businesses need to know now.
We'll work through what support can be provided, and we'll work through that, and I'll have more to say in coming days.
Will that be financial support?
Is lack of vaccine supply the reason why we haven't opened up eligibility for everyone?
We've had a number of reasons why the Commonwealth's vaccine rollout has been delayed, and it has been delayed. That is a fact. We should be at a much higher level number in terms of the number of people vaccinated than we are today. These are supply issues that the Commonwealth is responsible for, securing, procuring and then delivering the supply. So that's been one problem. And of course, the changes that were announced in regards to AstraZeneca had a hit on public confidence. But the third element is people have got to be willing to be vaccinated. As the Minister for Health, Professor Sutton and other public health experts, these vaccines are safe. And these vaccines, if people get vaccinated, it keeps our community safe. We would not be in this position that we are today, this necessary and difficult position that we are today, if our vaccination rates were much higher than they are right now.
So just to be clear, Deputy Premier, are you saying that until Victorians are fully vaccinated, lockdowns remain a possibility moving forward?
Well, what I'm saying, not just for Victoria, but every state and territory, for our entire nation, we are not through this pandemic until we've had the successful rollout of the Commonwealth's vaccine program, and we have effective alternatives to hotel quarantine. This pandemic in this nation and across the world will be with us for some time yet. So none of us are through it until those things happen.
Are you saying that Victorians
So
should...
go.
You mentioned this lockdown might end earlier than 7 days. What's the threshold? Is it 0 cases for us to come out of this early?
I might pass over to Professor Sutton to go through that. You know, all of us want this circuit breaker lockdown to be over as quickly as possible. The public health advice is that we think we need 7 days to get on top of this, but I might hand over to Professor Sutton to go through some detail.
Thanks, Acting Premier. I do think we have to ready ourselves for 7 days of this lockdown with, as the Acting Premier said, thousands of primary and secondary close contacts. They are individuals who've been exposed. Any one of them could become cases over the next 14 days from their exposure. So we really just need to see each and every day what new cases might emerge. Hopefully, all of the positives will be that they've been contacted, that they're in quarantine already, and that when they test positive, there are no new exposure sites generated. So the things to watch are the new cases that I'm sure will occur, but whether or not they're out and about in the community, whether there are new exposure sites that are putting others at risk. So they're the things to watch. It would be great if, of the new cases that I do expect, that they're amongst those 10,000 primary and secondary close contacts, and that there aren't new exposure sites that get generated.
How many cases are you expecting? Is it
Sorry,
hundreds?
can I ask, are the cases from today, are they all linked? Are you seeing links between them, or are they from different places?
They are all linked, so we know where transmissions occurred. Obviously, there's the workplace that's been identified, and all of the others are the related households and casual links for the Whittlesea, City of Whittlesea outbreak. So that's very reassuring. That's great work, again, of contact tracing, but it's also about people giving very detailed information about where they've been so that we can make those links appropriately.
A bit further down, when you say 10,000 primary and close contacts, am I correct in saying we've never seen that many in this short of time before? And if that's the case, how do we get on top of it in 7 days?
So we certainly haven't seen that number previously. Part of the reason for the big numbers that we've seen is that there were generations of transmission that occurred before the first case was even identified to us. So there's been opportunities for spread to people. The other clear element is the infectiousness of this virus. So when we're seeing a member in a household become infected, almost everyone in that household is infected. In a workplace with some people infected, there are many, many people infected. So it speaks to the infectiousness of this B1617 variant, but also the cycles that it's going through. It really is rapid, and that's led to the exponential increase.
Is that Victoria's the only
Sorry, one at a
state-
time.
What's your
please.
understanding of the quarantine breach that happened in South Australia? And can you also speak to us about what contact the individual had upon arriving in Victoria and how long it took the health department to engage with him after his arrival in Victoria?
So it's really for the South Australian government to speak to exactly what happened in hotel quarantine. I understand there's a report on what's occurred, and my understanding is that it's airborne transmission through the corridor, as we've seen too many times, with doors opening in relatively quick succession. That's something we've tried to mitigate in Victoria as much as possible with HEPA-filtered air purifiers in corridors, with a minimum standard of negative pressure to drive air back into rooms and not out into corridors. That's something that I think is a lesson for hotel quarantine across the board. That said, hotels are not the ideal structural environment to keep people. In terms of that individual leaving quarantine coming to Victoria, that's normal. That's a normal process. People who finish their quarantine are free to go across into any jurisdiction. We do have a policy in Victoria, it's reflected in South Australia as well, of giving people a prompt to get an additional test at day 17. In Victoria, again at day 21. I think that individual got a prompt from the South Australian authorities, but again, you'd have to go to them to understand that.
Victoria's the only state that's had 4 lockdowns of this kind. Why are we getting contact tracing so wrong?
So that's an absurd proposition.
Why don't we have
contact
enough faith in our contact tracers
Sorry, to
so that we
finish.
don't
It's
force
it's an
Victoria into
absurd
lockdown?
proposition that contact tracing has gone wrong. We've talked about exactly what the contact tracing team have done here. It is an extraordinary job. Contact tracing is an integral part of how to get control. It does not do magic. Every country in the world started with 1 or 2 cases in their countries and had contact tracing that could have worked within those limits. But that is not the whole story with contact tracing. And most countries in the world have had huge epidemics. When you've got an individual who's not infectious, who happens to have breached out of hotel quarantine, and they're in the community, if they're not infectious, there's nothing to respond to. You can do contact tracing, but if they haven't transmitted to anyone, I think that was the case in Sydney, despite being a confirmed case, no transmission within the household to the very closest contacts. If someone's not infectious, there is nothing to respond to. If you've got someone who's incredibly infectious, and we've had a case in this outbreak, and they've been around and about, as most people move in Australia now with the settings that we have, there is an enormous opportunity to transmit to many, many other people.
There's some kind of communication breakdown though, because...
Sorry, I'm going to ask one.
I'm just following on from that.
Would you like me to ask?
Yeah,
or was it-
Michael, and then I'll go back to you.
How are we going identifying a link to the original Wall Earth case? Are we still looking for that? And what impact, if any, will that have on getting on top of all of this?
We'll continue to try and find links, because if we can find a link, then we know if there are other people exposed and therefore who need to be in quarantine and getting tested. But, you know, detailed interview and re-interview hasn't identified the exact link. We know that genomics says that it's come from that wallet case from South Australian quarantine, but we'll continue to explore. It would be great if we know those links, as I say, but if we don't, it's really just a case of encouraging everyone who's symptomatic to get tested.
Mr. Health Officer, there's some kind of communication break. Just following on from that question before, there's some kind of communication breakdown going on here, though, when you've got businesses that have been called exposure sites telling customers before Victoria Health gets to them. We've got thousands of contact tracers across the state. Why are we not getting on top of it quicker?
So it's entirely appropriate. This is a collective effort. It's entirely appropriate for businesses with the channels that they have to contact all of their clients and customers when they know that they're an exposure site. We'll do the double and checking of details to get it up on our website, and people should check that. But when a setting knows that it's an exposure site, and they will have their own mechanisms. They've got their own Facebook pages, Instagram pages, they've got their client and customer lists, and they can email en masse and they can provide that information.
Isn't that
They will
confusing?
do and must do that as we formally put the exact times, verified, and exact locations on our website.
Do you agree that that's confusing, though, for people? When
We have to do everything in parallel at the same time.
Why not before?
All efforts need to be made. So if there are social media channels that businesses have, they can and should and really must use them, because there'll be some people who do not check websites. There'll be some people who will turn up at a setting and see the sign on the door. So we have to use all methods and media.
People need to know what's happening with elective surgery. Can you explain to people that have surgeries coming up what happens with that?
I think it's appropriate that the Minister for Health responds directly to that question,
Great.
and then I'm
I've
happy
got
to
a follow-up as well
Yep.
about the vaccine hotline, which is
Yep.
probably for Nicole as well.
So as per the last circuit breaker snap lockdown, all emergency surgery will continue, and of course our emergency departments will continue to be open, as will all our emergency first responders. In regards to elective surgery, the highest category of that, as per normal arrangements, will continue, but general elective surgery will be paused for the next 7
And
days.
can I ask you about the vaccine hotline? Apparently people can't get through on that number at the moment, so what should they do?
I'll get back to you on the phone number before this media conference is over, Richard, but we are in the process of bringing in substantially more resources to the hotline. We will more than double the number of operators in the coming time.
Can someone also explain what's happening with the construction industry? Does construction work go ahead? And can you explain
Yes,
what
I can.
authorised work is?
So we've been, since February, we've been in consultation with a number of different sectors, and the two notable changes from the authorised workplaces that can continue to operate from the February circuit breaker are, as you indicate, construction and emergency dental.
Minister Foley, can I be going
Back to the South Australian.
I'll go to Richard first, then I'll come back
vaccines?
to you.
Thanks, Seb. Just with the vaccines, the website has crashed. Are people able to turn up to get the Pfizer vaccine if they're over 40 from tomorrow? Or does it have to be booked? Just to be clear on that. There's lots of people asking
So
questions about that.
the booking isn't online, the booking is over the phone.
That's not working either, sorry.
We'll make sure that it is working. We're putting all available resources into that system, and we will make sure there were substantial delays over the past few days, and we've been ramping up the extra staff and the extra channels into the system to make sure it continues to operate.
And will any walk-ins be available at all?
Will
Any walk-ins be available at all for vaccination? Walk-ins.
Walk-ins. Under the arrangements we have in place and the nature of the Pfizer vaccine, we do require people who are eligible for Pfizer, now 40 to 49, to book, and we'd ask you to do that through the phone system. In regards to AstraZeneca, which is in all of the more than 30 plus state-run vaccines, as well as the scores and scores of private GPs and primary healthcare providers. Primary healthcare providers, you need to book with your GP, but we would encourage you to either phone or walk up if you're over 50 for the AstraZeneca.
Yeah, that's okay. We've been talking about the alternate quarantine proposal for months now. Where are we at? Is the federal government going to approve that soon?
We are making progress. So firstly, as I've said a number of times, the discussions between state officials and Commonwealth officials are very positive, very productive. We don't yet have the formal green light from the Commonwealth. We're waiting on their green light in terms of going ahead with the project and the Commonwealth funding the construction of the project, but we are making progress in what the state is doing. So we committed to invest $15 million and crack on with the planning and the design. We've now got approval from the Commonwealth to access the two sites. So Mickleham and Avalon, they're both both Commonwealth land. We've got approval from the Commonwealth to access those sites so we can do the detailed site assessment work that is required. The second thing that we're doing is that tomorrow we're releasing the expression of interest, an EOI, out to industry for its construction. So we are ramping ahead, doing everything that we can. We're grateful from the Commonwealth that they've given approval to access the sites, and I'm very much looking forward, hopefully, to a positive outcome in terms of delivering an alternative quarantine facility, and the Commonwealth funding the construction of that facility.
You said we wouldn't be in this position. You said we wouldn't be in this position were it not for the slow vaccine rollout and not having a hotel quarantine alternative. Should Victorians be angry with the federal government for that?
Look, it helps no one. It helps no one if I'm just standing here blaming circumstances or blaming individuals or blaming governments.
You have blamed
it is a
those
fact.
issues.
It is a fact that the Commonwealth vaccine program rollout has been delayed, and there are global reasons for that delay. You've got to supply, procure it, deliver it. We have seen a delay. We've also seen a reluctance from some people to get vaccinated when they are eligible. So it is a fact that we have aged care facilities where not one person has been vaccinated. These are facts. We need to get this vaccination rolled out as quickly as possible, and that's why we've been doing a lot of work about how we can quickly expand what we offer at our state sites, and that's why I'm really pleased that we've been in a position through Martin and his department that we can deliver Pfizer for 40 to 49-year-olds.
From your crucial question, what's going to happen to international flights? Are we going to put a stop to them?
No, the flights coming into hotel quarantine will continue, so those arrangements for hotel quarantine will continue. So no changes in that space.
Also, the mother...
I'll go around. Yep.
Why does the Commonwealth prefer Avalon over Mickleham for the quarantine site?
Look, we'll be able to talk in more detail once we conclude the discussions with the Commonwealth and we land on a site. We're pretty comfortable. Our preferred site through this independent analysis is Mickleham. but the alternative is Avalon. They're both Commonwealth sites. They would both work well, but we need to conclude those discussions with the Commonwealth. I'm very hopeful that we've got a positive outcome very shortly, and then we can go through those details.
Initially, when you launched it, it was going to be construction maybe in September. Would you bring it forward to as soon as
Rich, we want to bring this forward as much as is humanely possible. Expedite the planning and the design, expedite the construction. This is Commonwealth land, so there's Commonwealth planning overlays that can be expedited by the Commonwealth. It's the reason why we were so keen on getting access to the sites so we can do that detailed work. The Commonwealth have provided us with that access. It's the reason why tomorrow we're releasing the EOI. We want to move this as quickly as possible, and the reason for that is that, you know, right now we're dealing with an outbreak, and the advice from Public Health in terms of what we need to do, what all Victorians need to do. But we do know that this pandemic will be with us for quite some time, and that's why we do, even if it's going to be 6 to 9 months away, and we'll know the detail of exact construction timelines once we do that work. But we will still need that alternative quarantine, particularly for high-risk cohorts from high-risk parts of the world.
What's made Victoria unique? We're the only state that's had 4 lockdowns. Why are we in this spot once again? Does the government admit some mistake in this, some fault in this?
We are continually improving how we respond to the pandemic, and I just go back to the work that our contact tracers have been doing with this particular outbreak that originated from hotel quarantine breach in South Australia. But as Professor Sutton and other experts have talked about, there are those who are positive, who have the virus, but who simply do not shed or transmit. There are other individuals that are very highly infectious. Now, if you combine a very highly infectious individual with high-risk transmission settings, bars, clubs, a workplace, the particular workplace we're focused on at the moment, 10% of the workforce has returned a positive result. So when you've got highly infectious people operating in high-risk settings, we do have transmission.
But acting Premier, we've had 12 months to get this right. No other state's been in this position. We're not special. Every state has bars. Every state has areas where it's easy to transmit virus. Why is Victoria in this position, and why are Victorians the ones having to pay the price?
We've had, across the country, we've had breaches out of hotel quarantine. Across the country, we've had community transmission. Across the world, this is a global pandemic where millions and millions of people have died. We are not unique. Where we are unique is the work we did last year, all Victorians, in defeating the second wave. Now, we need to deal with the reality of this outbreak that originated out of a hotel breach in South Australia. We need to deal with the reality that the vast majority of our community in this country are not yet vaccinated, and that means we need to have these circuit breaker lockdowns, as we have seen, circuit breaker lockdowns as we have seen in other parts of our country.
Deputy Premier, today the lives of Victorians are changing once again, and many are probably wondering, what's the latest with the Premier's return to work?
So as I've said a number of times, and I spoke to the Premier this morning and yesterday as well, his recovery is going well. This was a nasty incident, fractured ribs, fractured vertebrae, very, very lucky, a very nasty injury and a long recovery. Anyone who's had a major back injury knows the duration, the pain of that recovery. But he's going well, he's walking. He put out a statement a little while ago that he hopes to be back in June. That's going to be subject to his doctor's advice, but he is going well.
How involved was the Premier with deliberations over the decision to impose this lockdown? Was he a participant in those meetings, or was it more consultation on the sidelines?
Engagement from myself. So as I've said a number of times, whether it's the budget, whether it's other big decisions, whether it's the pandemic and how we respond on the big issues, I'm regularly in contact with the Premier, but in terms of the day-to-day business of government, meetings, we want him focused on his recovery.
So is Dan on board with this decision to set Victoria back into lockdown?
Yeah, absolutely. Dan is supportive of following the advice of our public health experts, like all of us in this government. We know that by doing that is the best way to defeat this outbreak.
And have you got any update on Lisa Neville and Jerome Weimer, who've also been absent?
No, I don't at this stage. Lisa is recovering, and I spoke to her about a week ago. Jerome is ill at the moment, and hopefully he'll be back on his feet shortly.
I think Premier...
Can I just ask a few questions about some of the restrictions, please? Can I just ask about people?
Richard and then you.
Are they able to move before midnight tonight? Are they able to move to a second residence on the coast in country Victoria?
So, Rich, in terms of the settings we got in place, these come into effect. The directions from Public Health come into effect at 11:59. But we want people to be doing the right thing. This is about staying at their place of residence. Where you are tonight is where you need to be for the duration of this lockdown. That should be your place of residence. We don't want people moving around. We need people staying at home and only moving around as per those 5 exemptions that I've talked about.
Do essential workers need permits this time again?
No, they don't need a permit as such. We've got the, as the Minister talked about, we've got the list of authorised workers and workplaces. The only change to the previous lockdown, there's oral care, urgent oral care in dentists, there's construction that's been added, but we won't have a permit process.
Just on funerals, would you consider exemptions? I know there's a mother whose son drowned in a pool in Port Fairy who is really desperate to up that cap if she can.
Yeah, this is a particularly tragic case, as in my role as Education Minister, and it's every parent's worst nightmare. Giving your kid a kiss, they're excited to go off to camp, and then we have this tragic incident. So what I can say, we've got the settings in terms of funerals, which is a maximum of 10. But I've already indicated and had a discussion with Professor Sutton. I'll ask the public health team to get in touch with the mum because I think the funeral is on Monday.
Mr. Melito, just allowed to attend that funeral, or is
Well, that will be a decision of public health, as is absolutely appropriate. But we do have extenuating circumstances, so I've asked the public health team to speak with the mum.
What's your explanation?
Is there any consideration given to allowing people that have been vaccinated to continue about their normal lives, even just to keep the economy ticking?
It's probably more appropriate
Brett?
for Professor Sutton or the Minister for Health to respond. We are nowhere near herd immunity, but in terms of that health question,
Brett?
I'll ask Professor to respond.
Rich, there's no question that getting vaccinated and being 2 weeks after your first vaccine gives you a level of protection. One vaccine is not enough, but even for those who are fully vaccinated and 12, 14 days post their second vaccine, I think it's problematic until we have clear directive from ATAGI and a national standard in that regard. I also think it's problematic when you see people who appear to be breaking the rules, as it were, until you can show that you've got evidence of vaccination and that it's an entitlement that applies across the board. You know, if you suddenly see a gathering of 50 people and they all say that they're vaccinated, it doesn't send a great signal. So, you know, there's good science in the protection that being fully vaccinated gives. I think it's something we should continue to explore nationally.
And do you think there's any chance that this may not last the 7 days?
I've always said, you know, 7 days is like a billion years. It's really tricky to look ahead that far. We just need to follow one day at a time.
Do you regret?
Who obviously will be a bit reticent to go outside at the moment. You know, there'll be people who obviously will now be sort of staying inside with the announcement of the lockdown, obviously. Are you concerned that that may affect vaccination rates, people's willingness to leave the house and get the jab?
I don't think so. There's an absolute entitlement to come out to get your vaccine. I think demand will skyrocket, actually. People don't need to book in for today or for tomorrow. Tomorrow it starts. In the next couple of weeks would be great. So spread out, don't overwhelm the system. But if we keep rolling through tens of thousands, we'll get there, and we could be in a situation within 6 months in Victoria where we don't really need to face this prospect at all ever again.
Of
I would
lockdown,
hope.
you mean?
Of lockdown, even.
Within 6 months.
How many vaccines can
Sorry,
we do in a
Bridge?
day? Sorry. How many vaccines can we do in a day? How many would you like to see Victoria doing in a day? We had 15,000 yesterday, and that was a record.
We could probably do 30,000 easily. It does depend on supply. The primary care system can do even more. GPs across Victoria have signed up for this already, and there are more coming online all the time. They'll get a greater supply as time goes by, and there might even be greater prospects for them to have Pfizer in their GP stocks as well. That would be a game changer. It's not there yet, but I think we could get to 100,000 just in Victoria on a daily basis in total. That would be great.
The lockdown's obviously not going to work immediately. We need time to catch up. We've got 10,000 prime and close contacts. So how long do you think it will be until we start to see the effects of that lockdown working?
I mean, some of it will be immediate in the sense that people who are close contacts now, they won't have 100 close contacts themselves. They'll have 3 or 4 or 5. That does make a difference. But the real effects are still a few days away. It's fair to say that of the 24 cases we've got so far, all of that transmission occurred before we knew about the first case, essentially. So this is the time for the lockdown. This is the time when all of those exposed individuals who might now be becoming infectious from now onwards, we just want to limit their movements as much as possible.
There are still dozens of aged care homes.
Infectious is the Indian strain.
It's a very infectious strain. So one of the sublineages is the most infectious that we've seen globally. This particular sublineage may not be so bad, but it is not good. It is at least as infectious as the B117 or UK variant, and possibly more infectious. That was challenging enough. We don't want to have to deal with variants of concern like this again. Again, vaccination works against this variant, as for so many variants.
There are still dozens of aged care settings in Victoria with residents who haven't received their first dose. Do you think that the people who are most vulnerable in our community are going to be protected now?
We certainly need aged care settings to have vaccination coverage for residents and staff. That's something I understand the Commonwealth is cracking on with, and getting to the last numbers now over the next week or two. That can't come soon enough. There are still some aged care facilities where a good proportion are vaccinated, but we really want everyone who's eligible, doesn't have a medical contraindication, to get vaccinated, and also understanding that there are new residents coming in all the time, and so that program needs to have a kind of maintenance vaccination, and all staff, of course. But we've got those additional protections of no visiting. It's tough, but it's for a relatively short period of time, and that'll be a really important protection
How
as well.
confident are you that they're protected?
We know how vulnerable they are. 1 in 3 infected in aged care in Victoria last year died. Hugely vulnerable, and was the absolute epicentre of Victoria's second wave. So many tragic deaths occurred in aged care. So you can't do too much to protect those individuals. Vaccination, restricting visiting, but also for any aged care worker, anyone who's visiting with an exemption, because there are end-of-life exemptions, also need to make sure they're not symptomatic, haven't been to exposure sites, are not close contacts.
Where are our disability care vaccinations?
That's a question for the Commonwealth. I think it's struggling to get coverage. From what I understand, still a minimum of disability settings covered with the vaccine. They are another vulnerable population. They need to be vaccinated.
I'm not sure who the best person to ask is, but Australians from other states and New Zealanders that are stranded in Victoria, what's your advice to them?
So people are free to leave the state, so no constraints there.
And they can come back?
Other states don't let them in though.
Yeah, it'll be up to other jurisdictions to determine whether they can come back from Victoria with a test, or whether they're effectively only able to return into formal quarantine.
So today's 12 cases, were any actually linked via exposure sites, or were they all family or work contacts?
I'm not sure, Bridget. I think a number of them were identified as primary close contacts through being workplace close contacts, but some of those individuals had met workmates in other settings outside of work. So, they might be exposure sites as well.
Is Stratton Financial particularly a concern?
Sorry?
Is Stratton Financial a particular concern? Has that been one of the big sort of spreading sites?
Oh,
Workers have got it there and then been out on Chapel Street at
Yes,
footy, et cetera.
certainly these are young folk who've been to, loads and loads of, busy settings, indoor settings. Clubs and pubs and restaurants are high risk. Indoors, without a mask and exerting yourself, shouting, singing. These are high-risk activities. We need to watch them very closely.
Are there any new
Five still the
exposures?
index case?
Sorry?
Is case 5 still the index case?
Still-
Did they give it to everyone else?
Still the known earliest case as we understand it.
Are there any new exposure sites that are of particular concern to you guys?
Look, every exposure site's a concern. I think if people have a look at the exposure sites, if they reflect on the fact that if they're crowded, if there's exertion that happens there, or singing, dancing, chanting, they will be high risk, and the length of time that a case has been there will increase the risk. Gyms, we know, are a risk as well, and there are some gyms listed on exposure sites most recently.
Can you explain why construction has been added, and does that apply to all construction or just large scale?
So, following the circuit breaker lockdown in February, we were in conversation with construction industry, and the full details of not just major projects but maintenance, services and all the related activities that are caught by this particular exemption as a nominated work group will be up on the website. But essentially, it's construction of significant projects that can have COVID-safe plans in place, as was demonstrated in 2020.
So not residential, not two people on
I
the
don't believe
website?
so. And some residential sites are really big, some are not so big, and there's a mechanism in
Have you
place.
got any more details on this person who is in hospital in the ICU? Are they age, sex, gender?
Well, look, as Professor Sutton indicated, this is one of the first cases, and it's an elderly person, and we send our best wishes to that family, and we send our prayers for a quick recovery.
Were they eligible for the vaccine?
Well, clearly, yes, being over 50. My understanding is that just in recent days, we've passed over 50% of over 7-year-olds being vaccinated. Sadly, this was not one of those 50%.
Can I ask if fines are in place for people that breaking of these restrictions are the same as the last time we were in stage 3?
So Victoria Police, authorised officers, will be out there enforcing this system, and those fines can vary from on-the-spot non-mask wearing for a couple $100 all the way up to tens of thousands of dollars for businesses who deliberately breach these regulations.
On these new cases, can you give us an insight onto who they're each connected with?
I beg your pardon?
On the new cases, can you give us an insight onto who they're connected with?
So the contact tracing team have run down first, second and third generation transmissions once they've been reported extraordinarily quickly, but they're all related to the South Australian case through the indexing process that's happened. The genomics established that as they all come in. They're all coming back through the direct contacts, either family and close familial circumstances, or workplace or other settings. There's no such thing as a good case of coronavirus. There's no such thing as a happy set of circumstances for coronavirus infection. But the good news, if there is any, is that of these cases, they've all been able to be tracked down in those primary close contact or secondary workplace close contact range of circles, and that is the reassurance that we have. and that is why our contact tracers will be used this time, this short, sharp circuit breaker lockdown, to get ahead of this. And I'm confident with Victorians having been there in the past, know what to do, and that we can get on top of this and beat this.
Do you know the R number for this virus?
I beg your pardon?
Do you know, it might be one for Sutton, do you know the R number for this virus, how fast it's spreading?
I'll be back.
So the R0 or reproduction number for this virus is to be estimated, but given that the B117 or UK variant was estimated to be 50% more than the wild type or original virus, that might be in the 3.5 range. This might be closer to 5 or more than 5, but it's not 100% clear. So that means one infected individual on average infects 5 others. So that's 5, 25, 125, 625 in 4 generations. You do not want this to move unmitigated by contact tracing, by the restrictions that limit the number of contacts you have.
How many cases are you expecting to see in the next few days?
Really hard to know. I don't think, I don't think we'll see hundreds, but I absolutely expect more.
So can I just clarify, the gentleman who came from South Australia, I believe obviously the Indian variant is his variant, he's done his quarantine and then arrived here. So has he had his permit checked or had any interaction or special attention upon his arrival at Victorian airports from the Victorian health system?
No, so there wouldn't be a normal process for anyone who's finished their quarantine period is free to move about across any jurisdiction in Australia.
Is there an argument to pay closer attention to people coming from high-risk parts of the world?
I think it's worth a national conversation about whether we all agree that a 17-day test happens and that we flag and share information between jurisdictions about everyone who's left quarantine. We've had early conversations in that regard.
Acting Premier, do you have any estimates as to how much this 7-day lockdown will cost the economy? Obviously, it doesn't compare to the spread of the virus, but do you have a rough idea?
No, not at this stage. This is obviously a difficulty for families, for individuals, for communities, for businesses. It'll have an impact in terms of the economy. We'll make an assessment of what support we can provide businesses in terms of the impact, and I'll be making some announcements in coming days. But in terms of a broader economic impact, that's to be assessed.
Is last week's state budget now meaningless?
No, not at all. Not at all.
It was predicated on us not being in this situation, though.
Well, it goes to the importance of always following public health advice, and if we need to, have a short, sharp circuit breaker lockdown to make sure we don't have another wave. And that is the best way to protect our community. It's the best way to protect our loved ones, and it's the best way to protect our economy. What we have seen in Victoria, this is the engine room of the national economy. We have delivered since September last year 240,000 jobs, and that investment, that pace, that recovery will continue.
Is anyone able to?
Sorry?
What would you say to people panic buying?
Panic buying, don't.
Do not. There is absolutely no reason to panic buy, and people know this. Look at our experiences as a community through the circuit breaker lockdown in summer. Everything we need in terms of our goods and services on the supermarket shelves is there. There is absolutely no reason to panic buy. Please don't do it.
You spoke to the Prime Minister.
Announcement regarding financial support for businesses. You said it's not going to be made today. When?
I said in coming days.
When exactly?
In coming days.
What are you going to say to businesses today?
Well, we understand that this is particularly tough on businesses. It's particularly tough on event organisers, whether it's cultural or sporting events or other public events. We understand that this is going to impact on them. We'll be making further announcements in coming days in what support the state can provide.
You spoke to the Prime Minister this morning. Did you ask him for assistance with that?
No, not directly. I gave the PM an update in terms of our situation right now, the advice of public health, and also advised him of the expansion of the eligibility criteria for the vaccine. So it was an update talking on all those matters. The Prime Minister expressed his support and will continue to work with the Commonwealth on a whole range of things, whether it's the vaccine rollout, whether it's alternative quarantine, or whether it's support for business.
Victorians have been through a lot already. They provided
130,000 extra vaccines for us. Do you anticipate we'll be getting more? And do you know how many of that is Pfizer?
Well, as the Health Minister and myself and others have said over the last few days, in terms of supply, we've got what we need right now. Now, for the duration of the year through and beyond, how confident we are will depend on the supply that is coming from the Commonwealth. But in terms of right now, we have the supply we need. I acknowledge and thank the Commonwealth for the additional supplies that have been announced, and that must be prioritised to disability workers, to residents in aged care and other settings. We must make sure that our most vulnerable citizens are vaccinated as quickly as possible, and that is the responsibility of the Commonwealth.
Victorians have been through a hell of a lot already. How do you think this announcement today is going to impact people's mental health?
Oh, look, this is tough, and we know that. This impacts on families, it impacts at our schools, it impacts on businesses. You know, no one wants to be in this position, but I think the community also understands that we've got to follow public health advice. And we've seen overseas what happens if this thing gets away. You know, we must follow public health advice. And my view is that as tough as this is for everyone, I think people appreciate that we've just got to do this. And Victorians have shown what a brilliant job they do. And while I'm here as Education Minister, one sector of our community, you know, it'll be parents and carers of our children and young people. It'll be students at school. It'll be our workforce. We're going to have remote learning for a few days next week. I've directed my department that it's a pupil-free day tomorrow in the government school system, so that our teachers and staff can focus and prepare for a few days of remote learning next week. But my message to parents and carers, trust your school, trust your child's teacher. They know what they're doing. They did a brilliant job last year and earlier this year. They'll do a brilliant job again. In terms of Catholic education and independent schools, my recommendation is they have a pupil-free day, allow staff to prepare for remote learning for a few days, but that will be a decision that they will make. But even in terms of support, particularly for those kids that struggled with remote learning, this year we've got more than 5,600 tutors, as well as our existing teaching staff and other education support staff. So we've got 5,600 tutors, particularly focused on supporting those kids that really struggled during remote learning.
And what's the health advice to support the closing of schools, given that this age group aren't the ones that are particularly vulnerable?
Well, a circuit breaker lockdown is all about the movement of people. And that's why, you know, we go to those now 5 reasons to leave your home. So we're going to support vulnerable kids. We're going to support children of essential authorised workers to make sure that for those children and for those individuals with children, they're authorised workers, their children can be supervised at school, as we've done in previous lockdowns.
Just on the vaccine, was there any consideration of lowering the threshold to over 30s, over 20s, all for the Pfizer? Everyone over 16, like other states have done?
We want to extend eligibility as much as we can. You know, that's what the Minister for Health and his department want to do. We want to get as many people vaccinated as possible. It goes to what I said yesterday. It's about confidence of supply. We are confident to make the announcement today that for 40 to 49-year-olds, we've got enough Pfizer. So call the hotline, make a booking, and get vaccinated. We'll work through over the next few days and weeks. We want to expand that even further, but right now we've got the confidence in terms of what supply we have to extend it now to anyone over 40.
Just for our friends in regional Victoria who are watching, can you just explain to them why it is the same blanket rules? Obviously not as concentrated exposure sites as we've got here in Melbourne. They might just be wondering why it's as harsh for them.
Look, because we've got a big spread of exposure sites, more than 150 exposure sites right across the state. Kahuna, Bendigo, on our borders. So we've got to make sure, and there's also the risk of people in metropolitan Melbourne moving into regional Victoria and transmitting the virus. So there's very strong advice from public health that this needs to be a statewide lockdown, circuit breaker lockdown, and we'll make an assessment. Public health will make an assessment every day in terms of how we're tracking. It's 7 days. If it can be earlier, it will be, but it's a 7-day circuit breaker lockdown for the entirety of the state. Just one point in terms of people who live on the border and work interstate. So people on the border live in Victoria but work in New South Wales, for example. One of the other changes that we've made is that this is subject to New South Wales and South Australia, but if you live close to the border, you work in interstate in New South Wales or South Australia, whatever that occupation is, that person can continue to go to their place of work, and that's another difference to what we've had in the previous circuit breaker lockdown.
Just a follow-up to Mark's question. So there wasn't an option of locking down Greater Melbourne?
No, the spread, the 10,000, more than 10,000 primary and secondary contacts, the vast spread of exposure sites, the risk of transmission, the clear advice from public health is that this needs to be a statewide lockdown. I don't know if Professor Sutton, you want to add anything more to that?
You just mentioned the 150 exposure sites. Do they include, there were 79 on the website before the press conference started. Are there a bunch more we don't know about, or do those 150 include private gatherings?
I'll get the minister to explain, but there are some exposure sites that we know there's a number that is contained within that exposure site, so there's not a need to put it on the website. The ones on the website are exposure sites where there's significant public engagement with that site. Minister.
So, Rachel, if I understood the question, the tiering of the web...
So the acting Premier just said that there are 150 exposure sites. There are
growing.
79 publicly listed at the moment. Are there a bunch we don't know about, or are some of those 150 private ones, or was 150 incorrect, I guess?
No. The number grows all the time. Some are like people's private residences and those kind of arrangements, which clearly we're not going to list. So it's that kind of privacy arrangement.
Can I just ask, in terms of the 7-day lockdown and the amount of exposure sites and now close contacts, the writing was sort of on the wall for the thousands of people being close contacts when we knew about the MCG 2 days ago.
Yes.
If we were to make this decision earlier, would that have at all impacted the length of time we need to be in lockdown? Do you regret not making this call yesterday, or has the chain of transmission just already spread?
Well, as Professor Sutton indicated a couple of times today, through the work of the contact tracers, what we have established is that these chains of transmission that we've identified, first, second and third ring and generations, predated the first case in this South Australian case cluster in Whittlesea. So all the advice that we've got was that today was the day to go. And that's why we're making our announcement today. This is a necessary, strong decision to have a short, sharp, snap lockdown to give our contact tracers the opportunity to get ahead of this, work with our public health team, work with the community and get ahead of this. And then, as the Acting Premier has said, make sure that we all do what we can when we're eligible to get vaccinated and work as a nation to resolve the very risky environments of quarantine.
Professor Sutton.
Given there are 270,000 doses of Pfizer sitting there and we've been able to extend the eligibility, why have we waited until today? Why didn't we do it earlier?
I'm not sure who's feeding you these questions, but the clear answer is because we are making sure that in 2 weeks' time that those Pfizer vaccines get their second vaccine. We need to make sure that the logistics of rolling this out safely and consistently is what's delivered. And we've been working very productively with the Commonwealth to make sure that that's the situation. and our public health team, our hospitals who are delivering this service now have the confidence that we can bring the Pfizer program to 40 to 49-year-olds.
Could the lockdown be extended?
There's no plans to do that. What this is, as Professor Sutton's indicated, is a day-by-day assessment of the situation, and I look forward to working with the public health team, working with the Victorian people to make sure that this short, sharp lockdown is as short and as sharp as possible to keep Victorians safe.
On that, sorry, the duration of the lockdown, this is a far more aggressive outbreak than what thrust us into that 5-day snap lockdown. So how is an extra 48 hours enough to really kind of get on top of this?
Well, the view from the public health team was clear that faced with the options, 48 hours as opposed to the British variant earlier in the year just gives our team, our public health team, all of the Victorians who are involved in this massive effort to get ahead of this and to run it down.
Are you confident it won't be extended though?
I beg your pardon?
Are you confident it won't be extended?
I'm confident that every day Victorians will back this scheme in, do what they need to do to get ahead of this and help keep Victoria safe.
Professor Sutton, do you mind if we just ask you about your opinion on that? Do you regret that now, knowing what we do now, do you regret not going into lockdown, say, yesterday or even the day before once we knew about the MCG?
No, I don't. I think, we have to act on the information we have before us at any time. We needed to analyse everything that we knew yesterday, detailed discussions with Cabinet. There is a detailed process of writing up dozens and dozens of pages of public health directions today that will be charter compliant, that will make consideration about all of the things that you're weighing up in terms of the constraints that are very serious. So we had to go through that process. I'm confident that Victorians know what to do. They won't wait until midnight. I would also encourage them, if they've got plans that they can put off now that were for this afternoon, for this evening, people that they might normally have seen, to cancel them because we really need to start these measures as soon as possible. They become mandated from midnight, but Victorians know the right thing to do. We've done it before and we've done it better than anyone.
In terms of repatriation flights from India, are we still taking in repatriation flights?
Yes, we've got the arrangement and the agreement in place for repatriation flights. 27th of May, I think, is the one that's coming in. So yes, we'll continue our repat flights. We'll continue supporting hotel quarantine, but we need to make these changes to ensure our community is safe.
So 27th of May, that's today.
Yep, I think it's 3 p.m.
Right, so you've got no concerns that we're going to take in repatriation flights from India, where we now have this variant circulating that's more infectious?
Well, we've got a responsibility and an agreement at a national level to support the repatriation of Australian citizens and permanent residents, and they'll go straight through to hotel quarantine.
Getting the jab now that you're eligible? Will you be
Sorry?
Will you be getting the jab now that you're eligible?
Of course I will, absolutely, and that's what I said. As soon as I become eligible for the vaccine, I'll make sure I make a booking and get it done.
Acting Premier, sorry, just on the funeral I was referring to earlier, it's actually tomorrow, not next week. So is it possible something could happen today?
Yeah, absolutely, and I've already had this discussion. So, Public Health will reach out to the family of the little boy who lost his life in tragic circumstances, and we'll see what we can do.
Thank you.
Thanks all.
Thank you. And with that announcement by the Victorian Government, our latest lockdown works for 7 days beginning at midnight. The announcement raises numerous questions around vaccination, schools and businesses. And these are questions not just for Victoria, but for the whole country.
Thanks, mate. No worries.